Hey guys, I'm Molly from All Healthcare Careers. I'm going to be performing step-by-step CNA skills to ensure your success on the CNA clinical skills portion of the exam. Before we get started, I'd like to show you this CNA practice kit that we put together for you to practice at home with family and friends. It will be linked down in the description along with a video breaking down exactly what's inside the kit. Let's get started. Before entering the patient's room, I'm going to perform hand hygiene. 2 pumps of hand sanitizer. I'm going to knock on the patient's door before entering. Good morning, Mrs. Smith. I'm Molly. I'm going to be your CNA today. How are you doing? Is right now a good time for me to perform peri-care? Wonderful. I'm going to close your privacy curtain and collect my supplies. For this skill, I will need a basin with water in it, soap, a barrier, gloves, a privacy blanket, and washcloths. Before we get started, I'm going to put the privacy blanket over Mrs. Smith to provide warmth and also as much privacy as possible for this skill. Next, I'm going to apply my gloves. Then I'm going to take my barrier, also known as a chucks, and I'm going to roll it and place it underneath the patient to protect the bedding from becoming wet. So I will have Mrs. Smith roll over to her side. Mrs. Smith, I'm going to help you roll over, and then I'm going to take the rolled side and tuck it under Mrs. Smith. And then roll her back, and then go to the other side to unroll it. Just going to roll you back over, Mrs. Smith, just a little bit. There we go. And if your patient had a chucks underneath or any type of bedding that helps protect, you're going to want to remove that at this point before performing this skill. Okay. Next thing I'm going to do is I'm going to roll up the privacy blanket up with the gown that Mrs. Smith has on to perform this skill. Mrs. Smith, I'm going to roll up your blanket and your gown, so you will be exposed, but we will do this as quick as possible. Next, I'm going to place a dry towel underneath for when I'm ready to wipe. Next, I'm going to take all 4 of my washcloths and place them in the basin. I'm going to wring out my first one, making sure that your washcloth is folded over so that you can perform your corners, also known as the 4 leaves. So 1, 2, 3, 4. Then I'm going to apply my soap. So I'm going to start with my first leaf, and I'm going to start from the top and wipe all the way down the middle of the labia, all the way down. Then I'm going to take my next corner, and I'm going to go over to the right side of the labia and wipe, always wiping from the top down to the bottom. Then I'm going to go over to the left side, cleaning from the top all the way down. And then I'm going to clean the folds of the outside, inside of the leg. And then I'm going to make sure that I put this towel that is now dirty off to the side. Taking another washcloth, rinsing it thoroughly, and now drying. Same approach with the leaf, starting with the first one, cleaning from the top, middle of the labia, all the way down. And repeating. Now I'm going to take the towel that's in between and I'm going to dry gently in between the folds as well. Then I'm going to take my dry towel and put it off to the side with my dirty towels. Then I'm going to roll down the blanket and the privacy gown. And then I'm going to have Mrs. Smith roll over to her side so then I can perform care on the back side to her rectal area. Still making sure that the chucks is still in place as well as the privacy blanket. I'm going to take my washcloth. Well, actually, first we're going to take our next dry towel, and place it underneath for drying. Then we will take our washcloth, rinsing it, and applying soap. And at any time, if your basin has become cold, the water temperature is cold, or if it's really soapy, you'll need to change that out. So I'm going to clean the back side, starting from the top and around, and repeating on the other side. And then making sure to clean going down and up, and again, down and up. Making sure that you don't contaminate or allowing, if you have any soiled if your patient has soiled at all, whether it's urine or stool, you want to make sure that if you have a washcloth that you take that separately and discard it. We're going to repeat this same process by removing the soap, next I'm going to take my dry towel and we're just going to pat dry. And then discarding that. Then while Mrs. Smith is on her back, I'm going to take the chucks and I'm going to roll it away from me. Then have her roll back onto her back. Mrs. Smith, are you still doing okay? Good. Then I will go to the other side to remove of that chucks. And again, if your patient is someone who is incontinent, they probably will need a pad barrier, and this would be a good time after you have completed this skill to place a new one under them. I'm going to discard of my chucks. I'm going to remove the privacy blanket. Along with all of my dirty towels and place them in the dirty linen. Next, I'm going to disperse of the water. Remove my gloves. Perform hand hygiene. Place my basin underneath to rinse out as well. Dry this off. Then I'm going to place the basin along with Mrs. Smith's soap back into her closet. Mrs. Smith, is there anything else I can do for you right now? Wonderful. If you need to get a hold of me, please use your call light. Thank you. After exiting the patient's room, you're going to perform hand hygiene. 2 pumps of hand sanitizer. We hope you found this video helpful. For additional resources, click the playlist for more CNA skills videos, or try our 3 free-day trial that contains over 1,000 practice questions to ensure your success on the first attempt.